Showing this and every Wednesday at 4 p.m. on Vibetown Media.
Good evening, viewers. Welcome to your number one health show, Health Zone, on Vibetown Media. The topic for today is peptic ulcer disease, and we have in the house Dr. Yakub Yusuf, Medical Director, Kojach Medical Center, right here in Accra. Welcome, Dr. Yakub.
Thank you very much.
So, Dr. Yakub has been with us for a while, and he's been very helpful. We are grateful to have him as an associate, and he's here to tell us all we need to know about peptic ulcer disease. What is peptic ulcer disease?
Thank you very much. Peptic ulcer disease is a health condition which has to do with when your stomach develops some wounds or sores along the lining. It could go beyond the stomach. It could even be in the throat, the lower end of the throat, your stomach, and even a part where we call the duodenum, the upper part of your intestine. So this is, in short, what is called peptic ulcer disease, when you develop a wound in any of the walls of these areas that I just mentioned.
Okay, so can you tell us who is predisposed to getting this condition?
For predisposition, I think there has been some research that has linked genetic predisposition to development of peptic ulcer. We can't say that is the only or main cause, but then it's been linked to an extent that somehow certain people who have a problem with inflammation and how inflammation is managed could also tend to develop peptic ulcer easier than other people. For predisposition, this is what I can say. Yeah.
Okay, so are there other causes you would like to talk about?
Sure. Largely, people who have a long history of using non-steroidal anti-inflammatory drugs, piroxicam, diclofenac, ibuprofen. There are people who, my head, they take ibuprofen or diclofenac. So if you have a long history of use of these medications, you could develop peptic ulcer. One of the most important causative agents, or what is the culprit when it comes to peptic ulcer, is an organism called Helicobacter pylori, H. pylori for short. H. pylori gets into the system through all kinds of means. As a matter of fact, research is still trying to, figure out the various ways we get this Helicobacter pylori into the system. Kissing could be one of the ways you could get this organism, which could cause ulcer. Is one of the ways you could get this organism. Fecal-oral route. When I say fecal-oral route, I mean somebody who has ulcer discharges and then contaminates the hand. The hand usually has the bacteria, and then you go buy food that has been contaminated or water that has been contaminated with the person's fecal matter, and then you consume. You could also get the organism that way. This organism has been proven for a very long time to be the main causative agent of ulcers in human beings. Then, as mentioned earlier, if you have a genetic predisposition, it could increase your chances of developing ulcer much quicker, as well as if you have a long or chronic history of use of non-steroidal anti-inflammatory drugs called NSAIDs. You could also develop peptic ulcer. For those, there are people who smoke as well. Smoking increases your chances of developing peptic ulcer. And then we also have, leaving your stomach empty for a very long time. It's minor, but then it also contributes to your likelihood of developing ulcer. Thank you.
Thank you very much. So there are times where we meet people who tell us, oh, I have ulcer, I suffer from ulcer. It's on and off. The person will be fine one moment, and then maybe along the line at a certain point, it comes again. So can you tell us what are some of the things that might trigger it to rear its head out, like in people who already suffer it and it's dormant and then it comes again?
As mentioned earlier, I mentioned a list of some medications which could cause ulcer. Some of these drugs, if you are If you have ulcer, you shouldn't take them. Diclofenac, piroxicam, ibuprofen. If you have ulcer which is healing sort of, and you use these medications, they predispose you to intestinal bleeding, which could worsen your ulcer or could make it worse. Acidic fruits, you take the citrus family, lemon, oranges, etc., could also increase the stomach acid content, which could worsen your state of ulcer or could make it, as mentioned, exacerbated. Also, tomatoes. Many people might not know this, but tomatoes could also play a role in exacerbating your ulcer. That's if you already have ulcer.
Is it fresh tomatoes? Raw
Yes,
tomatoes?
fresh tomatoes.
Okay.
And mostly is about the pH. Even when you cook it, sometimes tomatoes form about 60-70% of certain stews that we prepare. And growing up, you remember sometimes it would be so sometimes sour that your parents would need to put saltpeter or akelm, as it is called, to reduce the acidity. So tomatoes, for example, could also exacerbate ulcer if you have it. As mentioned earlier, to citrus fruits could also increase your, could also exacerbate it. And for those who smoke, could also exacerbate your ulcer. Yes.
Oh, okay. If you just joined us, this is Health Zone on Vibe Town Media. We have in the house Dr. Yakub, Yusuf, and the topic for discussion is peptic ulcer disease. Yes. So we continue from where we left off. The month of Ramadan is fast approaching. Very soon, Muslims all around the world will engage in the Ramadan fast. So the important question, the $1 million question pops up again. Can people who suffer from ulcer engage in fasting?
Yeah, as the question is asked, fasting could actually worsen your ulcer if you have ulcer. So I always quickly ask people to speak to their healthcare provider. There are medical investigations such as endoscopy. There is colonoscopy, but then largely endoscopy is usually requested if you have a long history of ulcer to determine the extent of the ulcer. There are people who have very, very serious and severe ulcer, bleeding ulcers. Such people, I didn't mention this earlier, when they go to the toilet, they could see very black stools because your stomach is consistently bleeding. And blood, when the whole process of digestion has acted on blood, it becomes black. So you go to the toilet and for some strange reason, your stool is very black. So people with those kinds of ulcer, after speaking to your healthcare provider, would most likely ask you not to fast at all because you need to eat at very short intervals within the day. You eat small meals so that you don't keep an empty stomach. So some people might just be developing ulcer. They might not know. You could experience heartburns. People tell you, I have heartburns or my heart is hurting. It's not necessarily your heart. Your stomach is placed in terms of location, starting from within the chest before going down, and it's not too far from your heart. So you understand why people would think that their heart is burning when actually it's your stomach that is actually hurting. So when you have some of these symptoms, it's a sign that you could have ulcer. It's not automatic. There is a medical condition called GERD, gastroesophageal reflux disease, which could also present with similar symptoms other than ulcer. So it's important for you to have been diagnosed. Either a doctor requests for an H. pylori test, which is a stool, largely stool, there's blood, but then they might ask for a little bit of stool. They might ask for a little bit of stool, and then they look for the organism inside. Once they look for the organism inside and it's present, that means you have an active ulcer. They could ask for, as mentioned earlier, endoscopy. It's like a tube they insert into your throat. They take pictures to see the extent of the wound. As mentioned earlier, it's a sore, it's a wound in the stomach. Then all of these factors are put together to determine if you should fast or not. But as mentioned, it's not recommended. Once you've been diagnosed with ulcer, it's better you stay away from fasting so that you don't worsen the situation. And I'm very sure the scholars, I'm sure, have delved into this issue, the religious aspect.
Yeah.
But then medically, fasting could worsen your ulcer.
Thank you very much. Any diet recommendations?
For diet recommendations, as mentioned earlier, stay away as much as possible from, how do you call it, acidic foods, the citrus family, tomatoes. People go like, hey, if you take tomato out of my meal, what would I eat? Because almost every food has tomatoes.
I was just about to ask
the same
because
question.
it's true.
Yeah, it's true.
Most
you
of
can
our meals.
experiment. You can actually experiment. Largely, I'm not a dietitian, but then I know that there have been dietary formulations that largely takes tomato out of the picture or only adds very little. Ulcer can be treated and treated completely. You just have to go to the right sources. I've seen instances where people are supposedly treating ulcer, but they are taking medications. When you see it, they're actually making their ulcers worse. You have pain in the stomach because you didn't ask anybody. You go and buy diclofenac. You think, okay, diclofenac is for pain.
Yes.
Then you start taking it. Before you know, you start vomiting blood because diclofenac will make your already terrible ulcer worse. And then you start vomiting blood, or you go to the toilet and your stool is very black. So speak to a healthcare provider, speak to a dietitian if there need be. Take out acidic foods from your diet. Eat green leafy vegetables. They are very good. You need antioxidants. And then once you are on management of ulcer, let's say, for example, orthodox, you are given proton pump inhibitors like omeprazole, which prevent your stomach from producing too much acid. You're also given antibiotics, which are very specific to H. pylori. It's not just antibiotics. People abuse antibiotics a lot. Oh, I've heard that antibiotics can cure ulcer. Then they go and buy certain antibiotics. Know this. Antibiotics have target organisms. All organisms are not the same. Some do well in dark, moist areas. Some do well in light areas. That's the best I can explain for you to understand. So these antibiotics are designed to target these organisms. So once you're on medication, largely, stay away from some of these foods. If there is a need, speak to your dietitian to come up with a formulation for you. It would go a long way to help you manage your ulcer. Yeah.
Okay. So where we've reached, I think Doc has explained it as clearly as possible for everyone to know, because PUD is quite broad.
Yeah, it's broad.
He has managed to come down to the layman's level and explain this as clearly as possible. At the same time, we also have to know that there are certain complications that come with these conditions. So that if we don't take them serious, we would have to take them serious. So I would like him to go through some of the complications that you would suffer if you have peptic ulcer disease and you didn't take it serious.
Okay. It's become so common. Oh, in local parlance, oh, I have ulcer, or me were ulcer. Oh, not tarida ulcer, as the houses would say. They don't really go to the hospital. Have you taken to the hospital? Since last year when I went to the hospital, that's it. Listen, ulcer could actually cause so much bleeding that you lose so much blood that could become a crisis or an emergency. Ulcer could also, it's a wound in your stomach. Imagine if you don't treat a wound, what happens? It keeps getting deeper and deeper and deeper. So it could go beyond just the surface lining, which is the mucosa, and then go deeper into the tissues making up your stomach and perforate your stomach. Once that happens, it's a medical emergency, and some people might not survive because there will be sepsis, which is contamination of your blood, which can actually lead to death. It's one of the sepsis. Prognosis means your chances of survival or your exit from the condition in a very healthy way. What are the chances? It's very low in instances of ulcer if you don't get good medical care. You could also develop cancer. I've actually had or dealt with a case involving a guy who had about 3-4 years of ulcer, which he didn't take seriously. It's actually developed into an ulcer. We refer to the Kolebu, where they had to undergo a surgery. Luckily, when we did the tests, it hadn't spread, so it's still localized, and then they only took out the portion where there is a problem. It could cause blockade of your intestine. When your wound, if there is a wound and it's healing, it could cause scarring. When scarring is, some people, when their wounds are healing, you see some tissue developing around that area. So when your wound is probably healing, it could cause scarring, or the ulcer has been there for too long. It could cause scarring where now there's a blockade. You eat and then food cannot pass. This is also a medical emergency. They might need to do surgery to repair, remove the scarring, take out as much portions as possible so that food can pass comfortably. So these are some of the complications that can develop if you do not take your ulcer seriously.
So viewers, you have it here. The complications can be very deadly. So if you have certain conditions like this, or you have symptoms similar to some of the symptoms he's described here, you have to go to your healthcare providers, and then you run some tests and make sure you are fine. If you are not fine, you get taken care of. Instead of staying at home and also buying OTC, over-the-counter medications, and doing self-medication. Your final words?
My final words on this is mostly we pray. We spend time, if you're a Christian, talking to your God. If you're a Muslim, talking to your God, that God should give you healing. Remember, God wouldn't come down to heal you directly. There are people who might get their healing directly from God. Yet, God have also allowed the possibility of people to be smart enough to develop medications and treatment for virtually every condition that we have. As we speak, people are constantly working on ways to prevent some of these conditions, either by developing vaccines or developing medications. All you have to do is just pay attention to yourself when it comes to any health condition. Even no matter how terrible it is, you pray to God. There is somebody who has developed some medication that's supposed to make you feel fine. So take medications very seriously. Take your diet very seriously. Take your health very seriously. Once discovered early, when you start experiencing some of the symptoms, as mentioned earlier, chest burns, or like indigestion, or too much belching, and you go to the hospital and you're diagnosed of ulcer, treat it. Make sure it's resolved. Don't stop along the line. Don't do, as they mentioned, OTC. Don't go in for medications, herbal preparations which have not been certified by either MAMPON or Food and Drugs Board for the treatment of ulcer. What you should do is stick to the regimen that has been given to you by your healthcare provider. So these are my last words, and health is wealth. Never forget. In my language, they will say, "Fobrengba."
That's it.
Health is important.
Yeah, thank you so much
You're
for
welcome.
the
You're
education.
welcome.
Well, viewers, this is where we call it a wrap. Join us same time next week on Health Zone on Vibe Town Media. Shout out to my producer, Dr. Vibe, and his assistant, Prince, aka Platts. Join us same time next week. See you soon. Bye-bye.
Bye.
Showing this and every Wednesday at 4 p.m. on Vibe Town Media.